This is the story of the Donora Smog, an environmental disaster that killed 20 people and left thousands gasping for breath. Donora was an industrial hub, home to Donora Zinc Works and American Steel and Wire Company, crucial to the town's economy. With a population of just over 14,000, the town relied heavily on these industries for livelihoods. However, prosperity came at a steep price. The factories released tons of pollutants into the air daily, creating a toxic mix of sulfur dioxide, carbon monoxide, and particulate matter. The disaster began innocently enough on October 26, 1948. An unusually thick fog settled over the Monongahela Valley, but this fog was different. It mingled with industrial emissions, creating a deadly cocktail. A temperature inversion, a meteorological phenomenon where warm air traps cooler air near the ground, sealed the town's fate. The pollutants had nowhere to go, and the smog thickened day by day. As the smog enveloped Donora, residents suffered. Eyes burned, throats were raw, breathing became a struggle. By October 29th, the situation was dire. Emergency rooms were flooded with patients exhibiting severe respiratory distress. Dr. William Rongaus, a local physician, was overwhelmed by the influx of patients. He recounted how the smog was so thick that visibility was reduced to mere feet, making it difficult for ambulances to navigate the streets. By the morning of October 30th, the smog had claimed its first victims. Elderly residents and those with pre-existing conditions were the most vulnerable. As the day progressed, the death toll climbed. Panic set in as residents realized the gravity of the situation. The local government and factory officials were slow to respond, unsure of how to tackle the unprecedented crisis. Desperate for relief, Dr. Rongaus and other local leaders contacted state and federal authorities. However, the response was lethargic. It wasn't until a rainstorm on October 31st that the smog began to dissipate. The rain washed the pollutants from the air, but the damage was already done. 20 residents had perished, and over 6,000 were left with lingering health issues. The aftermath of the Donora smog was profound. The town, once a thriving industrial center, became a symbol of environmental negligence. The disaster prompted an outcry for better air quality regulations. The Public Health Service conducted a thorough investigation, concluding that the smog was directly responsible for the deaths and illnesses. The Donora smog disaster served as a catalyst for environmental change in the United States. It highlighted the dire need for regulations to control industrial emissions. In 1955, the Air Pollution Control Act was passed, the first federal law to address air pollution. This was followed by the Clean Air Act of 1963, laying the foundation for the comprehensive amendments in 1970 that established the Environmental Protection Agency, EPA. Today, Donora is a quieter place. The factories that once dominated the skyline are long gone, but the memory of the disaster lingers. The Donora Smog Museum stands as a testament to the lives lost and a reminder of the importance of environmental stewardship. The museum, housed in a former storefront, contains artifacts, photographs, and personal accounts from those who lived through the disaster. While statistics and regulations are crucial, the human stories behind the Donora Smog are what truly resonate. People like Mrs. Eleanor Workmeister, who lost her husband during the smog, provide a poignant reminder of the tragedy. Mrs. Workmeister recalled how her husband, a strong and healthy man, succumbed to the toxic air within days. Stories like hers bring a human element to the cold, hard facts. The Donora smog disaster taught America several crucial lessons. It underscored the interconnectedness of public health and environmental health. The disaster also highlighted the need for proactive measures rather than reactive ones. It showed that waiting for a crisis to unfold before taking action can have devastating consequences. The legacy of the Donora smog is evident in today's environmental policies. The disaster paved the way for stricter emission standards and more rigorous monitoring of air quality. It also fostered a greater awareness of the impact of industrial activities on the environment and public health. In recent years, the lessons from Donora have taken on renewed importance as the world grapples with climate change and air pollution. Cities around the globe face similar challenges, and the story of Donora serves as both a warning and a guide. It reminds us that the cost of inaction can be measured in human lives. As we reflect on the 1948 Donora smog, it's clear that the fight for clean air is far from over. While significant progress has been made, challenges remain. Modern-day smog events, though less deadly, still pose serious health risks. Continued vigilance, robust regulations, and public awareness are essential to prevent another Donora. The 1948 Donora smog was a wake-up call for America. It revealed the deadly consequences of unchecked industrial pollution and spurred a movement towards cleaner air. The disaster's legacy is a testament to the resilience of the Donora community and a reminder of the ongoing battle for environmental justice. As we honor the memories of those who suffered and died, we we must also commit to safeguarding our environment for future generations. The air we breathe is a shared resource, and its protection is a collective responsibility. Let the story of Donora be a catalyst for continued action and a symbol of the enduring importance of clean air for all. The residents of Donora could never have anticipated the magnitude of the disaster that would strike their town. The thick, poisonous smog that enveloped the town was unlike anything they had ever experienced. As the days passed, the smog grew thicker and more suffocating. People struggled to see a few feet in front of them, and the air was so acrid that it burned their throats and lungs. Children, the elderly, and those with pre-existing respiratory conditions were particularly vulnerable. Parents kept their children indoors, but even inside their homes, the air was thick and oppressive. Local hospitals were quickly overwhelmed. Dr. William Rongaus and his colleagues worked around the clock to treat the influx of patients. Oxygen tanks were in short supply, and medical staff were stretched thin. The smog was so dense that it seeped into buildings, making it difficult for anyone to escape its reach. Stories of heroism emerged, with neighbors helping each other to reach medical care or simply offering comfort in the face of an invisible, suffocating enemy. On October 30th, as the death toll began to rise, the town's leaders realized they needed outside help. They contacted state and federal authorities, but the response was slow. The severity of the situation was not immediately understood by those outside Donora. It was only after a rainstorm on October 31st that the smog began to lift. The rain helped to clear the air, washing away the pollutants that had hung over the town for 5 days. By then, the damage had been done. 20 people were dead, and thousands more were left with long-term health issues. The aftermath of the disaster brought about a reckoning. The Public Health Service's investigation into the smog was thorough, and its findings were damning. The combination of industrial emissions and the temperature inversion had created a deadly situation. The report concluded that the disaster was preventable and that measures needed to be taken to ensure it never happened again. In the years that followed, the Donora smog became a rallying cry for environmental activists. The disaster was a stark reminder of the dangers of unchecked industrial pollution. The Air Pollution Control Act of 1955 and the Clean Air Act of 1963 were direct responses to the lessons learned from Donora. These laws laid the groundwork for the establishment of the Environmental Protection Agency, EPA, in 1970. The EPA's mission to protect human health and the environment was in many ways born out of the tragedy in Donora. Donora itself changed in the wake of the disaster. The town's industries, which had once been its lifeblood, began to decline. The zinc works and steel mills that had provided jobs and economic stability were also the source of the deadly pollution. As these industries shuttered, the town faced economic hardship, but it also began to breathe cleaner air. The Donora Smog Museum was established to commemorate the disaster and educate future generations about the importance of environmental protection. The stories of those who lived through the smog are both heartbreaking and inspiring. Survivors like Mrs. Eleanor Workmeister, who lost her husband, shared their experiences to ensure that the memory of the disaster would not fade. Their testimonies helped to humanize the tragedy, turning statistics into stories of real people and real loss. The legacy of the Donora smog is evident in the clean air regulations that exist today. It serves as a reminder of the importance of monitoring air quality and holding industries accountable for their emissions. The disaster also underscores the need for proactive environmental policies. Waiting for a crisis to act can result in devastating consequences.